Since the war on drugs was declared in 1971, overdose deaths have been on the rise, breaking new records almost every year. Not only has the war on drugs failed to make our communities safer by stopping or deterring drug use, it's actually made using drugs more dangerous and increasingly deadly. How? It's actually one of the many lessons we should have learned from the failed experiment of alcohol prohibition. When the U.S. Constitution was amended to prohibit alcohol, temperance movement leaders hoped this meant an end to alcohol use, making the country safer. But actually, prohibition had the opposite effect, because criminalizing and prohibiting alcohol didn't mean people stopped drinking. Instead, it meant alcohol production, sales, and consumption now had to happen underground. This led to an increase in organized crime, government corruption, and more alcohol-related deaths caused by unregulated, contaminated, homemade alcohol. And that's exactly what we're seeing in the modern-day overdose crisis. During the first wave of the crisis, in the early 2000s, huge numbers of people were overdosing on prescription painkillers. Though these prescription opioids were sometimes misused, they were at least regulated and largely uncontaminated. However, as enforcement cracked down on the sale of prescription drugs, we saw an increase in heroin-related deaths through the underground market. And in response to the heightened enforcement against heroin, fentanyl, a synthetic and potent opioid, became more and more present in the drug supply. As fentanyl has become more prominent, overdoses have surged, and on we go in a vicious cycle. In fact, this phenomenon repeats itself so regularly, it's got a name. It's known as the Iron Law of Prohibition. The Iron Law of Prohibition describes the ways in which criminalization and prohibition of a substance doesn't decrease demand for a drug. All it does is increase the penalties for getting caught making, selling, or using it, which means illicit substances are constantly being altered to make them easier to hide, store, and transport. And, as a result of trying to decrease the bulkiness of a substance, these drugs generally end up increasing in potency and concentration, which in turn makes them a lot more dangerous and makes people more likely to overdose while using them. But in spite of knowing that prohibition just doesn't work, and despite the fact that in 2020 alone, 100,000 people in the US lost their lives in preventable overdoses, the only solutions politicians on both sides of the aisle seem to be able to offer are ones that further criminalize and marginalize people who are struggling. Make no mistake, this has never been a war on drugs. It has always been a calculated war on people. People use drugs, period. For better or worse, drugs are a part of our lives. Drug use goes as far back as human history, and it isn't going away. So, instead of trying to change what has always been the case, how can we instead work to create a society that treats people across the drug use spectrum with dignity and compassion? First and foremost, we need to remove drugs from the criminal legal system. Drug use is a public health issue, which is why criminalization approaches have never worked to stop use. Secondly, we need to reinvest all the money that is saved from moving away from a criminalization approach into building out a robust infrastructure of services and supports. This includes access to medication-assisted treatment, researching new forms of treatment, and ensuring that treatment is accessible for all people, not just white wealthy communities. Lastly, we need to create universal access to life-saving harm reduction services. Harm reduction support means access to sterile syringes, drug checking kits, naloxone, which is the overdose reversal drug, and overdose prevention centers. Imagine a world where we treat each other with care. A world where people aren't locked away for drug use, but offered a way to heal. Where treatments and harm reduction services are widely available, helping people overcome challenges and stay alive. We must choose a new path forward. We must end the drug war now.